Hello, this is Dr. Anthony Aureo. I want to talk about the importance of family history of diseases. Have your doctor ever asked you if you have history of certain diseases in your family? Many do take this question for granted, and some will even dismiss it with phrases like, God forbid, it is not my portion. Well, this is to highlight the importance of this question and why you need to make efforts to get those details, as it is essential in protecting your own health and preventing even death. Many medical conditions have genetic basis, making them to occur along bloodlines, such that once seen in a family, there is a risk to other members of the family. Some are because of similar exposure, being grown in the same environment, eating the same food, and having exposure to similar chemicals in the environment. All this could make certain conditions already diagnosed in your family member to occur in other family members. It mustn't manifest in every generation. So, certain conditions your grandparents suffered, for which your parents never experienced, can manifest in you or in your own children. What conditions are affected? Most cancers, especially that of the breast, the colon, prostate, skin cancers, but basically majority of cancers are implicated. Other metabolic conditions like diabetes and hypercholesterol, meaning you have high tendency to store more fats and its consequences. Hypertension has familiar tendencies. Heart conditions like cardiomyopathy, valve problems, or even the problem with the rate at which your heart is beating, what we call the arrhythmias. All these are possible causes of sudden deaths that do occur in some people. Other conditions like asthma and mental health disorders, even as common as depression or memory loss, or even psychotic conditions. All this has been known to occur along family lines. Why do you need to know this? Some lifestyle modifications may be helpful in preventing or delaying onset of some of conditions in at-risk people. So if you are aware that you have family history of these conditions, meaning you are at risk of it, certain lifestyle modifications may be adopted to reduce your risk of suffering them. Also, routine screening for some of these conditions are possible and will help early detection and prompt treatment, which always gives the best outcomes. What informations do you need to know about these conditions? One, you need to know who in your family suffered from this, because how related that person is to you by bloodline affects the risk. If you have a first degree relative like your siblings or your direct parents suffering a condition, you have a higher risk compared to when the condition was seen in a second degree relative like aunties, uncles, or cousins. So this is a wake-up call not to dismiss the importance of this question. This is stimulating you to pay attention to what conditions your family members have been diagnosed of. Find the necessary information that will help. For instance, what diagnosis was made? How was it made? We need to be sure that it's a properly established diagnosis by a qualified medical personnel and possibly if it was confirmed with the requisite diagnostic tests. We also want to know at what age this family member started having this condition, and if this condition led to death, at what age did this person die from this condition. All this information will be applied in either preventing the condition in you or in treating you and taking some drastic measures at certain time. For instance, if your family member have suffered a particular cancer that started at a certain age, especially if 2 or 3 members suffer this condition with similar pattern, say a woman in your family suffers from breast cancer that was diagnosed early, say 35, 40 years. We now know that the type of cancer in your family may be an aggressive type, coming early and probably killing faster. And so such people could be advised to have their breast removed before the age of such onset in other people. Meaning that if a young girl is known to have this risk, she could make efforts to start her family early, complete her family, and have reconstructive surgery that removes the breast and remove the risk of having the cancer. Some other people known to have failure of their heart valve at a certain age can have it monitored, and at the slightest complaint of chest pain or any related symptom, they could have this checked and possibly valve replacements on time recommended. You see, the family history the doctor wants to know, which many easily dismisses, is very vital in preventive medicine and also in ensuring that you get timely treatment that gives best outcome. I therefore call on you today to take serious this question whenever it's posed, and also to make efforts to keep records of conditions your family members have been diagnosed of, the age at which it was diagnosed, and major complications, including deaths that occurred because of this condition. This will save your life and also give you better quality of life due to improved management, even if you come down with such conditions. Do not take for granted inquiry into the medical history of your family. It is very vital and a prominent component of a quality medical history. And this is Dr. Anthony Arium, adding to health and social literacy. Thank you.